remediation is for every student. And maybe switch your mindset and don't think about remediation as remediation, but think about it as debriefing.
Remediation isn't a punishment. It's a pathway to deeper learning. Every class, every lab, and every clinical is an opportunity to revisit and reinforce. Welcome to Lippincott Spark, Illuminating Nursing Education, the podcast that fuels teaching, innovation, and leadership. I'm Dr. Kelly Drees. Each episode, we spotlight bold ideas, expert voices, and practical strategies to help you teach smarter, lead stronger, and stay inspired. Let's spark new thinking and dive into today's episode. Hello and welcome. Today, we're exploring a topic that's absolutely foundational to student success: remediation. In nursing education, we often focus on delivering new content. But what about the knowledge that didn't quite stick the first time, or the concepts that students thought they understood until they didn't? That's where remediation comes in. In this episode, we'll explore how remediation of both previously learned and unlearned material can seamlessly be embedded into every aspect of nursing education, from the classroom to the lab, from clinicals to simulations. It's not about reteaching. It's about reinforcing, reconnecting, and building the kind of deep, lasting learning that great nurses are made of. Our guest today is Karin Sherrill, a nationally recognized nurse educator, simulation expert, and faculty development leader. Karin brings a wealth of experience in test item writing, conceptual learning strategies, and innovative approaches to faculty training. She's here to help us rethink remediation, not as an afterthought, but as a powerful, proactive tool for student success. So grab your beverage of choice, your curiosity, and maybe a notepad, because this conversation is packed with insights you won't want to miss. Let's get started. Thanks for joining us, Karin.
Thanks, Kelly.
So let's begin with understanding the landscape. So I think about remediation, it often feels like an extra, something we do when students fall behind or they're struggling. But you see it differently. So what is remediation and who should remediate?
I think that is traditionally what we think of as remediation. In fact, when you look at the term remediation itself, to remediate is to correct something that's been done wrong. When you look at remediation related to the medical world, in fact, it's known as the process through which performance concerns can be addressed and facilitate a return to safe practice. Return to safe practice. That's the key piece. Oftentimes we think of remediation as simply relearning material that you didn't learn the first time. But if we switch that momentum, we think about how can remediation, in fact, reinforce safe practice, it puts a completely different turn on things.
You'll talk to faculty and they'll say, there's never enough time for new content. How can remediation be a part of this process without feeling like it's an added burden?
What I've seen in the past, many times faculty will push students to remediate outside of class. And again, like you said, it's an additional burden for students. It's great for faculty because they're like, I don't have to deal with remediation. Students will do that on their own after class. And in fact, many of products that are out there that are available for students will just push students, oh, you don't understand this idea right here. Go back and reread this chapter, reread this section in the chapter. And the thing is rereading something that you've already read is not going to solidify it into your deep thinking. It's not going to make it purposeful in the future. If you're repeating the way that you attempted to learn in the past and you weren't successful, then it's not going to work for you. You've got to come up with a different way to learn that material so it really deepens into your brain and you hold on to that information and retain it. So thinking about ways in which to make that happen for my students, I want to think about how I can build remediation into future classes, not making it an assignment for students after class, not making them remediate after their last exit exam on specific topics, but maybe I can build out some case studies in class that include previously learned material. So for example, today our main focus is maybe on endocrine disorders, and I have a case study that maybe has a client that has diabetes, but I'm going to embed into it some of the renal dysfunction that we talked about 3 weeks ago. and the impairment of kidneys and how to care for someone who's maybe in a stage 3 chronic kidney disease, something like that, so that I'm remediating students by including previously learned material in my current material. And it really pushes students to a higher level of thinking. The other bonus that it provides is it puts complexity into situations. Oftentimes we teach in silos. This week's class is on renal disorders. Next week's class is on endocrine disorders. So students learn material, it very sectioned off in their brain. And so when we start to combine and make these multifaceted patients with multiple complexities and multi-system conditions, they're remediating previous material while they are still learning new material. And they're looking at how things interrelate with something else. And it's more realistic to what they're going to be seeing in practice.
So when we think about those students who have scored really high on an assessment, 92, 93, 94, should they remediate? Or is it just for students that are not performing to where you'd like them to be?
Remediation is for every student. And maybe switch your mindset and don't think about remediation as remediation, but think about it as debriefing. We know that with every simulation, the importance of debriefing, it is the most powerful component of simulation, has been proven in study after study. The critical piece of debriefing learning in simulation, but also debriefing a case study or an active learning strategy or a clinical day, whatever it is we're debriefing, there's such power in that. Think of remediation as your debriefing process. So rather than making it this separate, painful entity, think about it as an ability to expand your learning.
What are some common misconceptions faculty have about remediation and how we can, like you said, further shift that mindset?
Again, I think it's so important for us to figure out how to get this learning into the deep components of the student's brain. Remediation of a chapter is not going to be beneficial. Presenting that material to them in a completely different manner might make all the difference in the world, and they'll retain it for the rest of the time. Putting in a variety and ways in which that information is presented remediates those components. They have to have that foundational knowledge to understand how to apply it in a different manner. So it will help faculty to switch the way in which they think of remediation.
Now that we've kind of reframed remediation as a proactive strategy for all students, let's talk a little bit about how it fits into the broader picture of conceptual learning. Like you said, you see these silos, we're teaching about this one week and this particular topic the next. How can conceptual learning and multi-system cases be part of remediation in a meaningful way?
Conceptual learning, I think, is the way in which nurses think. We think conceptually, whether we identify it that way or not. When we look at fundamental textbooks, they are built conceptually. When we look at the blueprint for the National Council exam, it is built on concepts of learning. But we in education have thought, okay, concept-based conceptually is very different than, body system-based learning. And we see these as two separate entities when in fact they're the same thing. Nurses think conceptually, and let me give you an example of that. If I've got a patient rolling in the door of the emergency room with abdominal pain, abdominal pain is a concept. The patient doesn't roll in the door with a big stamp on their forehead that says pancreatitis. I don't know that it's pancreatitis. I'm not caring for a patient with pancreatitis. I'm caring for a patient with the symptoms of abdominal pain, distended abdomen, maybe some shortness of breath because they're lying flat and their belly is distended. It's the concepts that I'm treating. So when you think about remediation, thinking of remediation from a conceptual standpoint builds those skill sets in your students. Rereading the chapter on pancreatitis or performing the chapter activity and questions on pancreatitis does not help me care for that patient. But if I can understand the concepts around abdominal pain, abdominal distension, breathing disorders with abdominal distension, that is going to allow me to not only care for a patient with pancreatitis, but care for many, many, many patients that are rolling in the door with pain.
It's a great example of how you've really embedded remediation into the classroom, but also I assume it would be appropriate in simulation and your clinical experiences as well.
One of my favorite things to do in class is each day that I have students in the classroom, I will in fact start with where they've been since I saw them last. So we start a very unofficial remediation by saying, tell me about the patients you took care of in clinical this week. Tell me about the patient you took care of in the simulation lab this week. Taking their ideas, things that they saw, and use that as a pretense to remediation. Oh, so you saw some patients that had kidney disorders. We talked about that in class 2 weeks ago. How are the patients you cared for the same or different than what we talked about in class? So that's building in remediation, but it's also tying clinical and simulation to the classroom, which is well supported in the work that Benner's done and the importance of bringing clinical into class. I may not be with those students in clinical that week, but letting them know that their learning taking place there completely relates to what we're doing here in the classroom, and allowing them to see that through the process of remediating through their live experiences that they've had since I saw them last. And that's, I think, a really important way in which faculty can help to bridge that gap and bring remediation non-painfully into the classroom.
I was thinking just a quick question about even students that might have that stigma with remediation. And again, that's for people who are struggling and those who are failing. And we just went over that it's for all students in every class and simulation and clinical. Is there any strategies or tips, or how would you present that day one of class on how remediation really fits into class? What are some key words or things that you can talk with students about how this fits into your class and it's not punitive? It is going to help you.
There's no question that remediation has a negative connotation, just the word in itself. When we were in school, the kids that had to remediate, like you said, were the low functioning students, and they went to remedial math and they went to remedial this because they weren't working at the level of their peers and colleagues. So one of the ways of shifting that, again, is changing the mindset and not even calling it remediation. Call it debriefing, call it clinical reflection, call it anything that's not negative. You're going to have student buy-in. Students know what debriefing is. They've been in the sim lab. Clinical reflection, what does that mean? Well, you think of that as journaling, but we're going to do some verbal clinical reflection this week. I want to be able to talk about things you've learned, listening to their stories, tying that back with previously learned material. And it's building in that remediation every single class. One of the questions, of course, that's always asked by faculty is, I don't have time for that. Yeah, I got to hit the door running straight up 9 o'clock. I got to get my PowerPoint flaring and flying, or I'm not going to get through all my material. That's a whole different issue that you need to think about. What is the way in which I teach my classroom? You've got to figure out a way to manage death by PowerPoints so that you can build in some of these richer, higher level cognitive ways in which to learn.
Let's get practical for those educators listening today, being able to explore how you can start embedding remediation into your daily teaching. So, Karin, are there any tools or strategies that you might recommend for making remediation really, again, a seamless part of class, lab, and clinical? Because they're so busy. And yes, we want to get through all our PowerPoint slides. What are those tools and strategies that have worked for you?
Simply by pushing yourself with each class activity, each case study, each discussion you have with your students, to frequently be tying it back to something previously. So today's case study in class, we're talking about that patient with diabetes, but I want to ask students about, look at this patient with diabetes who has this impaired renal function. How does this relate? And this is the question you ask the class. How does this case relate to the patient we cared for 2 weeks ago when we were talking about renal disorders? Compare and contrast. What's the same? What's different? And using that strategy builds in that remediation. It takes that student's brain from diabetes to, oh my gosh, how does diabetes relate to renal dysfunction? And builds that remediation right from that point. So it doesn't take a lot of time to make that happen. Again, what do you remember about this? And how is it the same? How is it different? And that's just, again, building those deeper thinking, clinical judgment, decision-making thoughts into that student's brain.
How can faculty development support the shift toward embedded remediation?
I think it's important for faculty to have a unified voice. I think it's important for students to have this way of teaching in all of their classes. Not that you can't do it in just your own class if you don't have buy-in, but start to have those faculty discussions. Ask your dean or chair, you know what, can we put remediation as a topic of discussion on the next faculty meeting? Or can we make it a topic of discussion at every faculty meeting? I want to know how other faculty are doing remediation. Are we on the same board? Are we embedding this into our courses and into our activities, into our sim? How are we making this happen? The other thing you could consider is the way my classroom was structured is that I had my clinical instructors, and I really was in control, for lack of a better term, of my clinical instructors. I had the ability to kind of guide and direct and mentor them in the clinical settings with my students, but I could also provide them with prompts. So every week I would give them prompts to be asking students that would help tie in, remediate what we learned in class last week. So giving some cue questions they could have maybe in a post-clinical conference or in a pre-class or any kind of discussion. I want you to highlight this week patients that have a decreased filtration, a GFR, whatever. And I want you to have those discussions and have students. And that's a form of remediation as well, but it's being delivered through my clinical instructors with actual patient cases, which is even better. It provides more realism. But that's part of the team. Your clinical faculty are part of that team. So how do I get that support? Well, I talk to my peers. I talk to my adjuncts. I invite other people into my class. If I have this built-in remediation and they don't understand how I'm doing it, come sit in one of my classes. I'd love to have you in one of my classes so you can see how I've done it. And maybe you can get some ideas of how you can better implement remediation into your class as well.
Let's talk a little bit about evaluation. How do you assess whether remediation strategies are actually working? Are there specific indicators, either a student performance or engagement, that you look for to evaluate their impact?
Of course, the most common one that everybody looks at is test scores. You hope that built-in remediation is going to improve that. But I think that the most important piece that you can do is when you start to see increase in student confidence level. I think that would be the greatest asset to remediation as you see that student building confidence in themselves. If they have a strong self-concept and built-in confidence in what it is that they're learning, then that's going to it's going to spread to all different areas, including the improvement of their test scores, their performance in clinical and everything else. Look for student feedback. Ask students, how is this working for you? Do you feel like this process of teaching is helping you to retain previously learned material? One of the things that I had done in my class for many years is we had a very much body system-based curriculum. We taught on every week seemed to be kind of siloed in itself, where we had our specific body system that we focused on. But I carved into my curriculum so that my last class of the semester was called literally multi-system patient. And I took all of the concepts, all of the disease processes, all of the stuff we'd learned throughout the semester, and I put these into some higher functioning complex patient scenarios who had multiple diseases within them. So that was a form of remediation. We spent the entire class doing application activities with these complex patients using the processes of prioritization, looking at, okay, they've got a problem with this body system and this body system and this body system, which is my highest priority at this moment in time. And as the patient's condition changed, how have my priorities changed? And it was really one of the students' very favorite classes. They were terrified before they came because there really wasn't prep they could do. They're like, how do we prepare for this class, Karin? We're not ready for it. But they walked away from there feeling like a real nurse, because those are the kind of patients that nurses take care of. Those are the kind of patients they see in clinical that they're overwhelmed by, and they don't have the ability to make decisions on the nurse is taking care of the patient. They're simply observing what the nurse is doing. So that's a great way to perform a very realistic type of remediation for the semester. You could also introduce that into the sim lab. If you have your students in simulation, maybe your simulation patients are all going to be multi-system. Rather than just going into the sim lab to care for a single system patient that correlates with that week's content, go into the sim lab and care for a patient who has multiple problems that correlates to content not only of this semester, but content from previous semesters as well, pushing the students to really regurgitate that from the back of their brains and dust it off and pull it forward and apply it to this current clinical situation.
Great remediation strategies and growth opportunities for the student. I love it. So Karin, before we wrap up, we always ask the guests to leave us with a little spark, a pearl of wisdom our listeners can carry with them. What's your spark today?
I'm feeling sparky, Kelly. I'm just feeling sparky. So
bring it on. Yeah. I'm listening.
Well, I think the most important piece to remediation, oftentimes we think of remediation as a goal for students to be more successful on NCLEX exam. And I hear that a million different times. But, we are completely looking at the wrong thing. If our focus is on passing, our students passing the NCLEX, our goal and our focus of education is wrong. What we need to place our focus on is practice readiness, knowing that remediation is going to make a practice-ready nurse. Now, the benefit of that is if our students are in fact practice-ready, they will be successful on the NCLEX exam. They'll have the skills they need. But don't focus on passing the test. Don't focus on passing the NCLEX. Focus on practice readiness. We need to improve the nurses that are going out there from nursing school so that they stay in the profession. They provide wonderful, safe, compassionate care to patients, making sound clinical judgment decisions. And we can absolutely do that through the process of continual ongoing remediation.
That's very exciting. Such a powerful tool. And to echo your insights, remediation should not be separate assignment, but embedded in every class, every day of learning. And like you said, it's about practice readiness. So thank you so much, Karin, for coming on the show and sharing your expertise and your insights. If you're a nurse educator looking to deepen learning and support student success, embedding remediation just might be your next best move. So until next time, keep igniting the future of nursing education. Thanks again, Karin.
Thank you.
Thanks for listening to Lippincott Spark. Be sure to subscribe, share with a colleague, and leave us a 5-star review. You'll find links below to learn more about Lippincott nursing products and services. Until next time, keep learning, keep leading, and keep sparking innovation in nursing education.